CTV News at 5 with Hudson Mack.
Good evening. The very future of healthcare as we know it in this country is on the table in Victoria this week. Canada's premiers and territorial leaders have come here, and at the top of their agenda is the way the federal government is making unilateral changes to the way it pays for your health. Last month, also in Victoria, Ottawa laid out a new per capita formula that is also tied to economic growth. The premiers are divided on the plan itself, but they stand united against the way the Harper government's putting it on them. CTV's Stephen Andrew reports.
Coming into their two-day meeting, Canada's premiers and territorial leaders are divided on how to fund healthcare. At issue, the federal government's take-it-with-no-discussion deal it laid out last month when finance ministers met in Victoria. Ottawa is tying healthcare funding to economic growth and handing out a per-person check to the province and territories. Some leaders are happy with the funding formula, others believe they will lose millions.
What Stephen Harper has done is create the division that we're seeing today. Now, maybe that was his game plan all along, because that's the kind of guy that he is.
Well, I'm not sure if that was the intent, but if it was, it's not having the desired effect.
Halfway through their meeting, a sign of agreement.
The premiers were unanimous that the federal government's decision to unilaterally decide funding was both unprecedented and unacceptable. And provinces and territories operate the national health care system. We are the experts in it. And we are sharing our expertise about innovations in healthcare, and we are working to help each other.
It's why Clark guided her counterparts before the meeting began through the new patient tower at Royal Jubilee Hospital, demonstrating innovations in healthcare such as private and public partnerships. Clark is trying to convince Ottawa to reward governments that lead innovation, giving them a bigger share of healthcare funds.
Your finance minister supported this deal when it was first put on the table. What's changed?
Well, nothing's changed. I mean, we've been, what he said when this deal was put on the table was that British Columbia didn't have a specific problem with tying growth in the health transfer to the rate of nominal GDP growth. I ran on that when I ran for leader and premier of the province. He said he did have a problem, though, with the idea that we were going to have equal per capita funding, irrespective of age.
Clark argues that provinces with aging populations like BC need more money, suggesting younger provinces such as Alberta, not so much. That's where the agreement ends.
What Albertans are entitled to is exactly the same funding under the Canada Health Transfer as every other Canadian.
The meetings continue in Victoria tomorrow. By then, Clark is hoping to have some of the disagreements worked out.
And Stephen Andrew joins us now live from the site of the First Minister's Conference. Stephen, some irony here that the Premier is opposed to per capita funding, because many viewers will recall that when she was Education Minister, that was exactly what happened to school districts in this province.
Well, absolutely, Hudson. I mean, at the time when the BC Liberals brought that in, they said they had to get the education costs under control, and they were going to give the school districts a per capita budget for each student that was in their jurisdiction. And here, she's dealing with exactly the same system, so it looks like a little bit like the chickens coming home to roost, Hudson.
All right, we'll see what happens when they meet again tomorrow. Stephen, thanks.
You're welcome.